We turn to item 5 on the equality analysis. Bill, may I invite you please to introduce the paper?
Thank you, Chairman. When I was introducing the previous paper about our organisational structure, I talked about shaping the future commissioning board around outcomes, clinical leadership throughout, patient public voice and everything we do, innovation in all of our practices, and importantly a real focus on equalities and tackling health inequalities. And I think that's the exciting vision, I guess, that draws many of us in this work together. And this is the practical example of taking forward one of those themes over the life of the Commissioning Board's Special Health Authority. We've published our equality analysis, and that, Chairman, does a couple of things. It satisfies our legal requirements, but I think more importantly it gives us a view of where we can really use our potential to make progress in this area. And the analysis, I think, tells us a couple of things. It gives us some reassurance up front. If we have that medical principle of first do no harm, it tells us that the life of the Commissioning Board Authority, with its functions that you described at the start, there is very limited scope to cause problems for people from different groupings. But the other thing, more hopeful thing it does, is outline the potential that we have to make a really positive difference through the way we design both the organisation but also our ways of working, what Kieran was talking about in the earlier discussion. And David and I were last week at what I thought was a very good session with the Equality and Diversity Council, where we opened up all of our design processes and proposals and asked people to engage and tell us how we could really, right at the start of the Commissioning Board, build in that focus on equalities and tackling health inequalities. And I think we had some very positive feedback and a lot of volunteers to come and be part of that. So that's what we'll draw into the action plan that we have in response to the analysis. And this is to put both the analysis and the plan before the board for your comments and your agreement.
Well, thank you for this. This is fundamental to what we, as an authority, must do in preparation for the board, which will, Bill, if I'm right, have a statutory obligation to advance health qualities.
That's right.
As part of its function. So we have to lay the preparatory work now. And as your paper says, in developing our work towards commissioning and commissioning support, make sure that no community or group is left behind in the improvements that we make to health outcomes across England. So this has to be, I think, the right direction of travel. The paper has already gone out, hasn't it? The analysis
it has,
paper.
Yeah, it's been published.
And what you're asking us to do today is to note that and to consider and approve a draft response to the equality analysis. Can I ask colleagues for comments or questions on the paper and the presentation?
I mean, the big thing for me is picking up on the theme of transparency. Is if we can be at the forefront of understanding what our own variation is by whatever measure you want, and getting that out there. You know, we're not in this alone. And if we can be as transparent as possible, then we can draw out the interventions which actively reduce unwarranted variation or inequity or whatever it is. So I think part of the role of the analytics and making that as public as regularly as possible, I think, will be important. So I think we have some mechanisms we may not have traditionally had.
I agree with that. Indeed, we've had very positive engagement with local government when we're talking about health and wellbeing boards as being places which will have a real appetite for exactly that sort of information and analysis, so that not just the health strategies, but actually some of those other public service strategies can really gather around, make sure no one gets left out.
I liked it.
Thank you. Ed?
Chairman, I would reinforce that. I think the importance of measuring this and having the analytical capability is essential, and I do then think that it's as important to build into the organisational development and training and leadership development of the organisation, an absolutely underlying belief in the importance of this, the performance expectations of this off the back of clear analytics which we will measure over time. So very supportive and really important.
Well, thank you. Bill, I think you can conclude from those comments that the board is very strongly behind the paper and has high expectations of outcomes.
Thank you.
So thank you very much.